Rising healthcare costs for this coming year have a lot of Nevadans worried. But this fall marks the rollout of Battle-Born State Plans, a public option for affordable insurance. So today in CityCast Las Vegas, I'm with Tabitha Mueller, bureau chief for the Nevada Independent, to find out if these new plans are actually affordable and effective, and who opposes them. It's Monday, October 20th. I'm Sarah Lohman, and here's what Las Vegas is talking about. Tabitha, can you explain Nevada's new public health care option?
Oh, man. Let's get in for this ride.
Oh, man.
So I think what we need to do when we start talking about the new public option is we need to go back to 2021 when this was put forward. So Senate Majority Leader Nicole Cannizzaro brought this forward as a way that she said to lower healthcare costs and make health insurance more affordable to average Nevadans. We're talking people with moderate to higher incomes, right? And so it's saying that we are going to offer this plan. And 4 years later, we now have these plans available, and you'll see them on Nevada Health Link, which is the state's Affordable Care Act health insurance market.
Right.
And what you need to understand is that most people get their insurance through their employer, right? So if you work for a larger business or a larger company, you can you'll get your insurance through your employer. But a lot of folks also don't have insurance through their employer. You're independent contractors, you work for a small business, or maybe you're so small that you can't afford to have a health plan for your employees if you're a small business owner. Those folks are the ones who really purchase off of that state's Affordable Care Act marketplace called Nevada Health Link. And these plans are offered on Nevada Health Link to help folks who are moderate to higher incomes have a more affordable plan, is the idea.
You know, to give an example of someone who might use the Affordable Care Act, your friend Sarah Lohman, right here on the mic. I have been signed up through the ACA in 3 different states for 12 of the past 14 years. CityCast does provide health insurance, but I've moved to an independent contractor role. So now I'm back in the ACA system. I'm sort of surprised by how many people aren't aware of the Affordable Care Act. Different portals, which are unfortunately different state by state, which is already confusing. So now Nevada has launched these Battle-Born plans, which is another layer. There's still like traditional plans available, but now there are certain ones I looked this morning marked with a cool looking bighorn sheep as a Battle-Born plan. They look badass. Are they badass, Tabitha? What is the difference?
So I think the biggest difference with these plans, they're the same as other plans that are offered on Nevada Health Link. What that means is they're qualified health plans. That means that they offer all of the they meet the requirements of the Affordable Care Act, some of which include that you can't be discriminated against for a pre-existing condition, right? If you have cancer and you need to buy health insurance, if you go to the Nevada Health Link and you purchase health insurance, you will not be denied because of that pre-existing condition. So that's really critical.
I have chronic migraines, which is surprisingly expensive to treat. So the Affordable Care Act, like making that a point of that you can't deny people based on pre-existing conditions, has kept me insured for 14 years.
Exactly. And basically what they did with these plans is they're required over the next 4 years to lower the premium cost by 15%.
Oh, wow. Okay.
That's not saying that we're seeing 15% lower premiums this year, but in 4 years, that's what we're going to be seeing is the idea. So that's the only difference is that insurers offering these plans, and there's 3 big insurers that have to offer them at a lower premium rate.
So that's the biggest advantage of signing up for one of these plans.
Exactly. Now, it's going to be interesting, right? Because folks signing up for the plans, maybe there's an option that's more affordable that fits in your budget because of how much you make. Like, there's a formula that you kind of go through, right, when you're applying for these, which is like they'll take into account your household size, your income, various factors, because there are subsidies that are available for citizens on Nevada Health Link, the state's Affordable Care Act marketplace.
Yeah. So I just want to restate to like who these new plans are for. Basically, if you're not getting health insurance through your employer and you don't have Medicare or Medicaid. Although, if you apply through the Nevada Health Link portal, you can qualify for Medicaid on that portal as well. It's all within the same system, as well as pick non-Battle-Born health plans or the Battle-Born plans. I did do a little window shopping, as they're calling it, and I did notice that all of the insurance is significantly more expensive than it was like just this past year. This past year, I've paid like $68 a month with my federal subsidies. And now I'm going to be paying more like $250 a month. What has happened, Tabitha?
So I think that you need to understand broadly that across the country, healthcare costs are rising, right? We're seeing cost of pharmaceuticals. Those are the drugs that you get from drugstores. That's more expensive. We're seeing just like overall rising costs. I mean, you go to the hospital, your bill is going to be higher than it was probably last year. Insurers are taking that into account when they're making these. Now, the other thing that you need to be aware of is that there are these things that are called subsidies that are on the Affordable Care Act marketplace. Now, the subsidies are still there, but there's these special subsidies that were implemented underneath the Inflation Reduction Act. And those are called enhanced subsidies. And those enhanced subsidies allowed people who are making 400% of federal poverty level, so moderate to higher income earners.
Right. Your average person.
Right, exactly, to qualify for more subsidies. Now, those are expiring this year. And that's what the big fight in Congress and the Senate is about, right? That's what this government shutdown is all over, is those enhanced subsidies. Democrats think they're really critical to keep. Republicans said we implemented these temporarily. We do not need to keep them. They're expensive. So that's what that fight is going on. But what that means is that people are sort of acting like they're already expiring. And you're going to see some higher costs, along with just an overall rise in health insurance. Like, we were talking with the Division of Insurance here in Nevada, and they were saying that on the individual market, which includes Nevada HealthLink plans and sort of non-employer sponsored health plans, an average of 26% increase, right? Just like across that, which is a lot. And with these enhanced subsidies, it's even more.
Yeah. So are the Battleborn plans here to save us? Is it going to fix everything?
I think that we're going to have to wait and kind of see how these play out, right? I think that the biggest concern that folks have is, as these rising costs are happening, are people going to just not get insured, right? I mean, any health insurance person will tell you it is absolutely vital to have health insurance, right? If the catastrophic things happen, you want to make sure that you are covered. And that's something that Nevada HealthLink officials are really emphasizing. They are going out there and they're saying, we know that costs are higher, but we also know that we want you to be protected. We want you to stay insured, because that's the best way to get preventative care, to see your doctor regularly. If you're not seeing your doctor regularly, you might have to have an emergency to discover that you have cancer or something catastrophic.
Yeah. I mean, of course, there's always the fear of getting hit by a car and you're suddenly $30,000 in debt when you're uninsured, right? But I think we do often overlook the long-term benefits of preventative care and regular checkups. People live longer and more fully when they're receiving regular health care, which also confuses me, because that also means they're more productive and profitable for the nation's economy. I don't know why we don't have free health care. I'm just going to have a tiny freak out and break out of my journalism shell for a second and scream to the mountains.
It's interesting because
benefits our country. Yes, go on, Tabitha.
It's interesting because I think I was recently at a forum where some folks in the audience were expressing that exact same sentiment of just why is it so expensive to have healthcare and why is it so hard? And I think it's something that like a lot of folks are navigating, and our politicians are having to navigate as well. And I think that this Battleborn state plan that we're talking about was sort of one of the like, well, hey, here, we're working on getting this lowered for you. Yeah.
Hey, Las Vegas, ever look for a sign of what to do? Well, here's one, literally. The Neon Museum is offering a limited time deal just for Nevada residents. 50% off admission to one of the most iconic must-see spots in the city. That's right, half off to explore Vegas history through the glow of vintage neon signs. Just swing by the box office, show your Nevada ID, and you're in. No promo codes, no online hoops to jump through, just a classic local appreciation deal. Make it a night with friends, bring visiting family, or finally check it off your Vegas bucket list. Visit the Neon Museum and let the lights of old Vegas shine for you. Now, this dazzling deal won't last forever, so grab your tickets now and experience the glow before it's gone. Again, to apply the discount, just bring your Nevada State ID card to the Neon Museum and purchase your ticket at the door. To learn more, visit neonmuseum.org one ticket per valid ID. Expect a haunting good time at the 12th annual Halloween at the Magical Forest. Admission includes rides, the Magical Forest Cemetery Walk, the Forest Express train, nightly entertainment, and trick-or-treat stations. So make a night of it and enjoy dinner at one of the many food outlets, including a beer garden, open select nights for the 21 and over crowd. As one of the primary fundraisers for Opportunity Village, attending directly supports people with disabilities in Southern Nevada. So during the 2025 season, Halloween, it's open October 20th through November 2nd from 5:30 to 9 p.m. Sunday through Thursday and 5:30 to 9:30 Friday and Saturday. It's conveniently located right there on Oakey Boulevard near Torrey Pines. Tickets for Halloween can be purchased online at www.halloveen.org. The cost is only $25, and you can stay updated with the nightly hauntings by following the event's social media accounts on Facebook and Instagram at Magical Forest OV. So grab your tickets now, halloveen.org. The Water Lantern Festival is coming back to Las Vegas on Saturday, November 1st at Sunset Park. It'll be an unforgettable evening filled with community, connection, and thousands of lanterns lighting up the water. It's a family-friendly festival that has something for everyone. Food trucks, live music, and activities to enjoy before the lantern launch. Gates open at 3 p.m., the festival runs until 7, and the breathtaking lantern launch begins at 6 p.m. You should head on over to their website and check out some photos from prior events. They really are stunning. And each ticket comes with your very own lantern kit and marker so you can create a personal design, whether it's a message of hope, love, or remembrance, and then watch it float across the water alongside thousands of others. So don't wait, this event often sells out. Get your tickets now at waterlanternfestival.com. That's waterlanternfestival.com.
And I just want to say, too, that often people stay in jobs where they're unhappy, unfulfilled, don't pay well enough because of health insurance. And I kind of want to put out there, too, that like the ACA is always there. Even though we're in open enrollment right now, you can apply at any time if you have a significant life change, including leaving a position. My role changed here at CityCast. I was able to get health insurance to finish out the rest of the year, too. So always it's there. You pay into it. Let's use it. So I know, though, the rollout of this plan, which I should reemphasize, too, that the idea is it's going to decrease in cost by 12% over the next 5 years. Is that the idea?
Not the ACA, but that over the next
Battleborn.
4 years, the Battleborn State Plan premiums are going to be decreased by 15%.
So hopefully we'll see it getting less expensive rather than more expensive compared to other plans on offer. But I know that there has been a little bit of a rocky rollout. There is opposition for it. Can you tell me who is not such a fan of these plans and why?
So when these plans were first talked about in 2021, the healthcare industry came out in full force against it, right? There were a lot of concerns and fears and saying, oh my gosh, we're going to cause insurers to go insolvent. There's going to be all of these problems because we're going to force them to lower costs. To meet the lowered premium reduction rates that are required underneath this law, health insurers kind of had a couple of options, right? One of those was to reduce costs by cutting broker fees and commissions. And broker fees are the people who sell you insurance. So if you're shopping and you work with a broker, it's kind of like working with a real estate agent where they'll sort of talk you through what the options are, how this works, how to use it. So that was one of the options, was to cut fees or commissions for them. The other option was to cut reimbursements to providers or find ways to save on overhead, like reducing executive salaries or other administrative costs.
Let's do that.
So if you think about it, like what insurers did, because they were given these options, is insurers cut commissions for brokers and fees for brokers. So brokers that are offering you all these types of plans on Nevada Health Link. And Nevada Health Link doesn't just offer these Battleborn State plans. There are other plans that are on there as well that meet those Affordable Care Act requirements that say, here is what we want you to cover and what makes a good health plan. Now, those brokers, because they're not making any money off of commissions from these Battleborn State plans or very little money, they're upset because they're saying there's no incentive for me to offer these plans to my clients, right?
Yeah.
And
I read your article. It almost seems a little bit like revenge. I mean, they're worried about their livelihoods, the brokers, because this is how they make money. So now they're just not going to offer the plans if somebody
well,
if someone doesn't ask about them.
Well, and it's not, I want to preface this, but this is not all brokers, right?
Right,
we
right.
spoke with one broker in particular who said that. And he was like, I'm not going to offer this. And even if my clients ask me, I'm going to dissuade them. And we can talk about why that's problematic in a minute in terms of
Maybe
state
not
law.
legal. Yeah.
Yes. I think the other thing that we heard from a lot of brokers is that the plans will create financial problems for insurers, right? Some of those issues that we heard back in 2021. And it's interesting because the state has sort of said, no, like these plans are the same plans as other ones. These are going to be fine. And they implemented what's called a reinsurance program to help offset some of these costs. And we could go into depth in this reinsurance program, but like the thing that you need to know is that it's basically reinvesting money back into the state to help insurers navigating high cost claims. But that's what brokers are upset about. And one broker in particular who we spoke to said, I'm not going to offer them because of concerns about the plans, and that the state was putting him kind of in this between a rock and a hard place, right? And this is problematic because brokers, by law, they're required to inform their clients of all of their options when it comes to health insurance.
Yeah, and just a heads up, you do not have to go to a broker. You can just go right to nevadahealthlink.gov.com. We're not paid by Nevada HealthLink, by the way. I just have to do this every single year of my life. Nevada HealthLink. Give it a Google.
NevadaHealthLink.com. You can also Google it. Yeah. NevadaHealthLink.com.
You can totally do it on your own.
They also have insurance navigators who are not paid by commission. So that's another thing. But yeah.
And they help you fill out the forms in the application. I distinctly remember Governor Lombardo calling this a bullshit piece of legislation. His words, not mine. Why does Governor Lombardo think this is a bullshit piece of legislation?
You are absolutely correct. Governor Lombardo called it bullshit, and he also called it political theater, right? He said this is just political nonsense. And like we mentioned with this broker and with other folks, critics of this plan said it could exacerbate, the healthcare shortage in Nevada. It could cause, it could destabilize the insurance market. But the law had already passed at this point. Like it was going to be implemented. There wasn't much that the governor could do unless
Sisolak signed it.
Yes, exactly. Sisolak signed it into law in 2021. So what ended up happening is that his administration adopted this reinsurance program. And he said that this reinsurance program would help stabilize the venture, right? And do you want to get into the details of that reinsurance program?
Yeah, let's do it. Because I have heard that both Republicans and Democrats are pretty happy with Lombardo's addition in the end.
Right. And I don't think this was ever maybe fully out of the question, because this was done as part of the implementation of this public option. And what reinsurance essentially does is it acts as insurance for insurance companies. So it pays a portion of high-cost claims and allows insurers to lower premiums for individual health insurance plans. And then as those insurance premiums are lowered, the amount of federal dollars that are spent on Affordable Care Act tax credits also goes down. And instead of keeping those dollars, the federal government then puts that money through to the state that then funds this reinsurance program and maintains those lower premiums and that market stability.
So it makes up the gap for the insurance companies between what the healthcare costs and what they're charging for it. Is that essentially it? Okay.
Yeah, it's like basically a way to just say, hey, we're going to help alleviate some of these rising costs that you're seeing.
Interesting. Now, we are actually not the only state that's rolling out a public option. It's a movement, Tabitha. It's kind of exciting. So Washington State, Colorado, and Minnesota have or are about to launch public option healthcare plans. So, what is stopping other U.S. states or even our federal government from having a public healthcare option like this?
I think it's hard. I mean, you have to think about it. Implementation is really hard. It took us, 4 years to get this, and we're still having some issues. And there's still concerns from a lot of different parts of the industry, right? Obviously, you have the brokers who are frustrated, and I get that. It's hard, to make ends meet right now. But then you also have the fact that some people I think are really hesitant because of this fear of like destabilizing the market. It's a new venture. It's not really been tried. We still are like waiting to see how it all plays out. I think also there's this sort of political noise around the issue that puts it into different camps and makes people sort of buckle down a little bit and say, we're not going to implement this or we are going to implement this.
I had hoped that this ultimately was going to be a free public option healthcare because, of course, I travel a lot. And in the majority of developed nations around the world, if I got hit by a car, I would not be charged for my healthcare. But offering healthcare to Americans seems to be a political issue. Why do you think that is?
Oh, man, I think that's like the $1 million question right there. Yeah. The U.S. healthcare system is set up completely differently from a lot of countries. And I think that what folks will say is they'll point to the plethora of options that you have when you go to a hospital, or you don't have to wait for services necessarily, or we have some of the most cutting edge medical treatments that are available in the state. That's because of the unique system that we have, right? And I think there's almost and I think that folks want that idea of like individual choice, of being able to say, well, I get to pick what plan I have, or I get to pick what my coverage is, or I get to have that. And there's an individualization that folks really want that may be sort of different culturally from other countries when it comes to healthcare, if that makes sense.
Yeah. I don't really want an individual option if everyone's healthcare is free, though, to be honest, in my opinion.
Well, I think that's like something that folks have to grapple with is like, what is it that we want individually? What do we want across the market? How are we navigating this issue? And I think that you also have to understand that individual states are implementing this. And there's a few other states that I think are implementing something like a public option. But to get change like this at the federal level would be a huge, massive lift. And I mean, we're arguing here over enhanced subsidies and whether to keep them and the cost of that. Right. That like I just don't know if it's something that the federal government would realistically be moving on anytime in the near future.
And interestingly, these public options that these states are passing are actually something that Obama wanted as a part of the Affordable Care Act. And now the states are stepping up to fill in this last sort of like discounted booster. So we might also see some of these healthcare premiums drop depending on what the federal government does post-shutdown. Is that correct?
Yes, absolutely.
Okay.
But also maybe it won't change and you'll see the prices that you're seeing now.
Yeah.
I don't have a crystal ball. If I would be winning a lot of money on lottery tickets, let me tell you.
Lottery tickets in Nevada? No, you got to cross state lines.
That is true. But I could go play the slots or whatever,
That's true. We could go play the slots. So if someone listening does not have health insurance, what do they need to do to sign up for this new public option or any healthcare plan?
So I think that the main thing is there's a couple of different ways. I think what's key is that there's a window shopping period, which you talked about at the beginning of this, right? Which opened October 1st. So you can go on Nevada Health Link website, which is nevadahealthlink.com, and you can start perusing these plans and sort of getting an estimate of how much it might cost you. Now, I
just did it this morning, by the way. You put in a couple things, household size, income, a couple other things that might give you some discounts, and then it shows you what your plans will look like.
Right. And that's not a guarantee, but it's a good ballpark estimate for most families. You can begin purchasing them November 1st, and enrollment closes about 2.5 months later on January 15th. Okay. Now, the thing that I will say is that to ensure you have coverage by the start of the new year, though, state officials have said buyers need to sign up for insurance by December 31st.
Right, and pay your first month's premium, and then you'll have insurance for January 1st. Okay.
Exactly. So you can wait until January 15th, but you might want to do that probably sooner.
Okay. Tabitha, thank you so much. I appreciate your time and your knowledge.
Thanks so much, Sarah.
And that's all for today here in CityCast Las Vegas. Hey, if you enjoyed our show, share it with a friend, maybe someone who needs to be insured. You can rate the show and leave us a review, and also subscribe to our morning newsletter, Hey Las Vegas. You'll like it. And don't forget, you can support this show and get great perks by becoming a CityCast Las Vegas neighbor at membership.citycast.fm. We'll be back tomorrow morning with more news from around the city. Take care.